Hey friends, welcome back to the channel. Today we're diving deeper into something that touches so many of us as the years add up: poor blood circulation. If you've noticed your feet staying cold even when the room feels just right, if your legs start aching or cramping after only a short walk to the mailbox, or if that little nick on your shin from bumping the coffee table takes weeks to heal instead of days, you're definitely not alone. I hear this from folks all the time. The really encouraging part is that once we understand what's going on, we can catch it early and make real, lasting improvements. So settle into your favorite chair, maybe grab a warm cup of tea, and let's walk through this together step by step, like we're chatting in the living room. Let's start with the basics so everything else makes sense. Your circulatory system is basically your body's highway system. The heart pumps bright red, oxygen-rich blood out through the arteries, carrying fuel and nutrients all the way down to your toes and fingers. Then the blood picks up waste and returns through the veins back up to the heart and lungs to get refreshed. When circulation slows down, especially in the legs and feet, those tissues start running on low fuel. The two most common reasons we see in folks over 60 are peripheral artery disease, usually called PAD, and chronic venous insufficiency. In PAD, the arteries get narrowed by plaque buildup, just like mineral deposits slowly clogging an old pipe. In venous insufficiency, the one-way valves in the veins get weak, so blood slips backward and pools in the lower legs instead of heading home. Both issues become more likely with age, but the great news is they respond beautifully to the right steps. Now, why does this start showing up more as we get older? It's a mix of things that build up over decades. Our arteries naturally lose a little of their youthful flexibility. Think of a garden hose that's been out in the sun for years and gets a bit stiff. On top of that, years of higher cholesterol, blood pressure, or blood sugar can quietly deposit plaque. If you smoked or were around a lot of secondhand smoke, that directly injures the delicate lining inside the blood vessels. Carrying extra weight around the middle adds constant pressure on the whole system. And here's one that surprises a lot of people. If we've spent years sitting more than moving, whether it's from retirement, joint problems, or just cozying up with a good book, the calf muscles that normally act like a second heart, squeezing the veins to push blood upward, stop doing their job. Family history can make some of us more prone, and for women, the drop in estrogen after menopause can also play a role because estrogen used to help keep vessels flexible. The honest truth is most of us have picked up at least a couple of these factors by our 60s or 70s. But, and this is the part one love, many of them are things we can actually influence starting today. Let's talk about the warning signs so you can spot them before they get louder. First, they're sneaky. The classic symptom is aching, cramping, or tiredness in your calves, thighs, or even hips that shows up when you walk or climb stairs and eases up after you rest a few minutes. Doctors call this claudication, and it's your muscles politely saying they're not getting enough oxygen. You might also notice your feet or hands feel unusually cold to the touch, or you get pins and needles, numbness, or tingling. Legs can feel heavy, like they're wearing lead boots by the end of the day. Look at your skin. It might appear shiny or tight, hair might stop growing on the lower legs, or the color can change, pale when elevated or a bluish tint when hanging down. Swelling around the ankles, especially in the evening, is another big clue, and you might see more visible, ropey veins. Small sores or cuts heal much slower than they used to. Men sometimes notice it affecting other areas too. Any of these ring a bell? Don't brush them aside as just old age. These are your body's early signals asking for help. And I want to be straight with you about what can happen if we ignore those signals. Poor circulation doesn't stay quiet forever. Tissues that stay underfueled are more open to infections, and those infections can spread faster because healing is slower. In more serious cases, wounds can turn into ulcers that are very hard to close. The same plaque that's narrowing leg arteries is often forming in the heart or neck arteries too, raising the chances of a heart attack or stroke. In the most advanced situations, tissue can actually die, and that's when the risk of losing a toe or worse becomes real. That's why I'm so passionate about talking about this. Catching it now keeps us independent, keeps us walking our grandkids to the park, and keeps us enjoying the life we've worked so hard for. Okay, let's get to the part you've been waiting for, the things that actually turn this around. The single most powerful move you can make is quitting tobacco in any form. Nothing opens up blood flow faster. Even if you've tried before, today's options are better than ever. Your doctor can prescribe nicotine patches, gum, lozenges, or medicines that calm the cravings. Many people also find support groups or phone coaching incredibly helpful. Within just weeks of stopping, your circulation starts improving, and your risk of further damage drops dramatically. Now, if lifestyle steps alone aren't getting you where you want to be, modern medicine offers gentle and effective help. Your doctor can start with a quick, painless office test called an ankle brachial index. They simply measure blood pressure at your ankle and arm and compare the numbers. It takes about 10 minutes and tells them exactly how well blood is moving. They might also order a simple ultrasound to look at the arteries and veins. From there, common medicines include statins to lower cholesterol and calm plaque, blood pressure medications to keep vessels relaxed, or a specific pill called cilostazol that improves walking distance for many folks. Low-dose aspirin or similar blood thinners can help prevent clots. In more stubborn cases, procedures like angioplasty, a tiny balloon opens the artery, or even bypass surgery can restore flow. But most people never need that if they stay consistent with the daily habits. One more area we can't skip: taking extra good care of your feet and legs every single day. Wash them in warm, not hot water, pat them completely dry, especially between the toes, and apply a gentle moisturizer to prevent cracks. Check them morning and night for any red spots, blisters, or cuts you might not feel. Wear well-fitting shoes with good cushioning and avoid going barefoot. If you have diabetes, schedule regular visits with a podiatrist. Those extra eyes can catch tiny problems months before they become serious.
Friends, I want you to remember this. Poor circulation is incredibly common, but it doesn't have to run the show. Start with just 1 or 2 changes this week. Maybe that short evening walk after dinner and swapping one salty snack for some fresh fruit. Keep a little notebook and jot down how your legs feel after 10 days or 2 weeks. You'll probably notice small wins that keep you motivated. Most important of all, bring this up at your next doctor visit. Tell them exactly what you've been feeling. They know your full health story and can build a plan that fits you perfectly. No guesswork, just real support. If this conversation made you feel a little more hopeful and in control, do me a favor and hit that thumbs up button. Share it with a friend or family member who might be dealing with the same thing. We really are all in this together. You've already taken a big step just by watching and learning. Keep moving, keep caring for yourself, and I'll see you right back here in the next video. You've absolutely got this. Take care and remember, you're stronger than you think.